Greetings, I'm Samuel Jordan, President of the Baltimore Transit Equity Coalition. Downtown Baltimore residents benefit from access to public transit, offering access to jobs, healthy food, education, healthcare, and community development. But the further you get from the city center, including into the surrounding counties, access to transit decreases.
When I go to Hampden, I will roll over to the light rail, take it up to Woodbury, and then catch the 21 at the light rail station, which is almost an act of faith rather than an act of scheduling, because even though they say the 21 has a schedule, that has not been my experience.
Our latest report on transit equity and environmental health shows Baltimore Transit often is unsuccessful in providing efficient and timely transportation. Importantly, data indicates people of color are the most impacted group of individuals when it comes to this problem. In Baltimore, this group makes up the majority of transit users. They are at a huge disadvantage when it comes to facing unreliable transit. We mapped 4 key metrics for Baltimore City and the surrounding counties: transit equity, social vulnerability, pollution, and health. In all the maps, a darker color indicates areas of greater need.
If Baltimore had a robust transit system, it would take me half the time to get places.
When we mapped transit equity, we see the patterns marking major differences between white and black residential areas. We see opportunities to improve average commute time and the difference in commute time between those taking public transit and those using a personal vehicle.
If I need to get to Hampden, I need to plan on spending 2 hours traveling. Getting to Hampden is taking buses that don't always arrive when their schedules say they're going to. And you have to put that in the plan when you're going anywhere.
When we looked at social vulnerability, we again see racial differences emerge. The darker areas show neighborhoods whose residents are more likely to live in poverty or to be people of color, most likely caused by historically racist policies in the city, such as redlining, which kept black people from being able to buy property in certain parts of Baltimore.
Now that we live downtown, we can take the Blue Line to baseball games, and that's very exciting. But people out, say, by Hopkins Bayview, can't just hop on the Red Line. They have to take 2 different, sometimes 3 different buses if they want to see a baseball game.
Looking at air quality, we saw the areas close to the Patapsco River in the southeast had a higher burden of air pollution, possibly related to Baltimore's port industry emissions and the incinerator. We also found that more data is needed at the neighborhood level to better understand the full impact here, as data on factors such as air toxins, cancer risk, and PM 2.5 was not widely available. It is critical to be able to accurately measure these factors in order to assess their impact on the health of residents, especially in neighborhoods such as Brooklyn, Curtis Bay, and Hopkins Point, which are located in close proximity to Baltimore's port and carry a disproportionate burden of the air pollution in the city. When we looked at health outcomes related to air pollution, we saw hints of patterns indicating racial inequity. But downtown and areas along the water lit up as places for opportunities as well. Arbitrary borders are keeping us separated. Transit can connect us. The Baltimore Regional Transportation Authority, BRTA, would be a locally controlled entity that would focus on the needs of the greater Baltimore region. It would build a robust transit system bringing equitable travel to those who use transit for work or fun.
If we had the Red Line, it would show the city of Baltimore that somebody gives a damn. Baltimore's forgotten who it is, and I think to be treated with respect again would remind the city just who it is and just how much we have yet to do.
Let's work together to build a better Baltimore region and connect those most in need of jobs, healthy food, education, and healthcare with exactly what they need through strategic improvements in public transit.